Hello, I'm Heather Oleary, PGY5. I conducted this project with Celia Geck and with my supervisor, Dr. Rebecca Gomez, at the Operational Stress Injury Clinic at the Royal Ottawa. This is a qualitative exploration of how veterans diagnosed with PTSD experienced stellate ganglion block. Qualitative design is an important component of quality improvement to capture nuances that may not have been expected, especially with new treatments. The stellate ganglion is a collection of nerves between the 6th and 7th vertebrae, is connected to the amygdala, and is involved in the sympathetic nervous system response. SGB involves injection of a freezing agent into the region. The Royal Ottawa OSI Clinic is currently completing a case series to study effectiveness on veterans and RCMP with PTSD receiving SGB. There is minimal to no qualitative data available on the direct patient experience of receiving this procedure among the veteran population. Participants were 6 veterans attending the OSI clinic. They were enrolled in the case series, and we used propulsive sampling, eventually ending up with 4 responders and 2 non-responders. I conducted semi-structured interviews with 6 participants. These lasted from 40 minutes to an hour and 20 minutes. Thematic analysis was employed to process the data collected from the interviews. This method uses a bottom-up approach, identifying themes from participant responses. You start with transcription of the interviews and distill it down into themes and subthemes. The goal is to understand the experience. It is not for effectiveness. 5 military and 1 RCMP were enrolled. The mean age was 55.2. And these were the quantitative scores as well of their PCL-5 and QIDS. So the first theme was the procedure room experience. 4 participants described anxiety going into the room. 3 described appreciating the transparency, specifically of being able to see the ultrasound procedure on the screen and being able to ask questions. 3 spoke of comforts in the room, specifically having someone from the OSI team present, and one of them having his support animal. 2 described wanting family for different reasons. The second theme was waiting for an effect. Sub-themes here involved the perception of immediate relief from 2 of the participants. 1 participant describing a wave of calmness after the procedure. Here are more quotes, and 2 participants, the non-responders, described the disappointment upon finding out that it hadn't worked for them. The 2 other participants described a general easier time out in public, specifically with regards to shopping. 1 participant described some concern about a side effect, as he did not recall whether or not this was one that was to be expected. 3 reported benefiting from feedback from others in determining whether it had worked for them or not. The next theme was the impact on the interpersonal relationships. So 3 participants described improved functioning from the reduction in anxiety, contributing to improved connectedness with others. 2 described improved communication. Further subthemes, these were the non-responders. 1 described the chronicity of his illness impacting relationships, and the other described a perception of rejection. Illness appraisal was the final theme. So 2 participants described increased acceptance of their illness and of themselves with their illness. The 2 non-responders described the experience of this being another treatment that's not working for them and how that affects their view of their illness. One participant continued to have a more of a military appraisal that it's not trauma, it's part of your job. Limitations included sample size, that this is cross-sectional and there's potential for bias. Implications are that these findings highlight the depth and range of experiences of patients undergoing SGB for PTSD, and this information can be helpful for quality improvement and to improve their experiences. Thank you for attending, and I hope you enjoy the rest of your research day.